This is Clyde Yancey, Professor and Chief of Cardiology at Northwestern University Feinberg School of Medicine and Associate Director of the Bloom Cardiovascular Institute at Northwestern Medicine. I'm also one of the co-PIs for a very important clinical trial called RECHARGE. Yes, there are clinical trials all over the place, but this trial is different. Funded by the Patient-Centered Outcomes Research Institute, we're trying to understand what's the best way to revascularize multivessel coronary disease in persons who are women and in persons who are marginalized, minoritized, or self-identify as a minority. These groups typically have not been in our large PCI trials or even in our large surgical trials, yet the burden of cardiovascular disease is at least the same, if not in fact perhaps higher in minoritized individuals, meaning we ought to have information at the ready to help us understand how best to have the conversation with our women that have symptomatic coronary disease and need revascularization, and with minorities that have symptomatic coronary disease and need revascularization. We can't simply extrapolate the findings from large trials, admittedly, the trials done absent those populations, and say something like this: well, it should work in you. Well, in the trial it worked like this. It should work with you. The patient has every right to say, has this intervention been done in someone who looks like, who feels like, who's experienced life like me? And we ought to be able to give an informed answer. That's what RECHARGE is about. 2 concurrent trials, one focused on women, but one focused on minorities. If we can answer these questions, we can do something we've never done before in the whole realm of coronary revascularization trials. We can specifically answer the question, yes, we know that for PCI or CABG, we have a reason to understand how you might do if you receive either intervention in the context of the life and living circumstances that you know. That's relevant for women, and that's relevant for minorities. We, academic medicine, should have the wherewithal to step up and answer that question and make certain that the context of our answers reflects the context of the patients for whom we care. Let's all support RECHARGE and see if we can get to the point where these questions are answered. Thanks very much.